So for the next video, I'm going to be going over some different testing we can do in seated, supine, and prone. So for the first seated, we're going to be doing the Sperling's test. So for this one, I'm going to have the patient stand up straight. Go ahead and I'm going to have the patient just laterally flex his head just about 20 or 30 degrees. Go ahead and hold that position. Then supporting the back of his head, I'm going to supply a compression force down. And the test would be positive for like a radicular neuropathy if it would produce any symptoms. Next is the quadrant test. So what I'm going to have the patient do is I'm going to have him extend, rotate, and laterally flex his head over to one side, and then kind of similar to the Sperling's test, I'm going to apply compression force, and the pain, if there was any radicular neuropathies, pain would be reproduced. Now I'm going to have the patient lie in supine. Go ahead and lie on your back. So for this first one, I'm going to be providing a passive distraction. Go ahead and put your head up here more. And it doesn't matter which hand, but because I'm right-handed, I'm going to cup the back of his head under my right hand, and I'm going to wrap my left forearm around his head to stabilize it. I'm going to put my stomach on his head to keep it even more stable, and I'm just going to provide a passive distraction. And the majority of it's coming from my right hand, because if I was to use primarily my left hand in this, I'd be providing some jaw pain. How's that feeling? Great. You feel it moving? And that test will be positive if there is a reduction of symptoms. So next, I'm going to be going over some different muscle stretches that I can do while in supine. So for the first one, I'm going to do levator scapulae muscle. And for that one, I'm going to have the patient still in supine. I'm going to cup my hand around his head. And for this, I am going to have him flex. Relax. I'm going to have him flex, laterally bend, and rotate his head away. And then I'm going to depress his scapula. And he should be feeling it. You feeling a stretch in there? Okay. And then for upper trapezius, it's pretty similar. I have him flex, laterally side bend, but rotate his head to the left. And once again, I add that, I depress the scapula. Feeling it? And you should be feeling that stretch along his upper trapezius. And then for the scalene muscles, it's almost identical to the upper trapezius, except this time I'm going to have the patient extend. And sometimes it helps to make a little chin tuck. That way his lower cervicals are extended and his upper cervicals are flexed. And then once again, lateral side bend, contralateral rotation. Go ahead and depress that scapula. Feeling it? Okay. And those are the muscle stretches. And then go ahead and lie on your stomach, Ethan. And lastly, I'm going to be presenting some unilateral PA glides along the cervical spine. So getting his hair out of the way, showing all of his cervical spine, coming down from the suboccipital fossa into C2. Then I can go into C3, and then moving just laterally. I should be on the facet joint of C2, C3. And then picking up the slack on that side, the muscular slack. Yep, now I feel the facet joint. And then adding the PA glide, just a straight anterior through that plane. How's that feel? Feeling it move? Any pain?
Mm-mm.
No pain?
No pain.
And then I would repeat it on the opposite side for bilateral movement. So picking up the slack. Picking up the slack of that muscle along his neck. Any pain?
No.
And that is the special tests in seated, supine, and prone.